Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Pregnancy. First trimester. What to expect. Introduction. The first trimester of pregnancy refers to weeks 1 through 12. Pregnancy lasts about 40 weeks, counting from the first day of your last normal period. During the first trimester, changes affect almost every organ system in your body. These changes can trigger symptoms even in the very first weeks of pregnancy. As your body changes, you might need to make changes to your daily routine, such as going to bed earlier or eating frequent small meals. This program explains the first trimester of pregnancy. The program includes information about your baby's development, your physical and emotional changes during this time, your first visit to the healthcare provider, lifestyle changes during pregnancy, and when to call a doctor. First trimester. Your baby. The first trimester of pregnancy is a time of intense changes for you and your baby. By the end of the first trimester, your baby's major organs and nervous systems have begun to form. After your egg is fertilized by your partner's sperm in one of the fallopian tubes, it forms a one-celled zygote. The zygote has 46 chromosomes, 23 from you and 23 from the father. These chromosomes help determine your baby's sex, as well as many other physical traits. The zygote moves along the fallopian tube and into the uterus. The cells divide and form an embryo. When the embryo reaches the uterus, it settles into the uterine wall for nourishment. It is here that the embryo slowly develops. During the 5th week of pregnancy, your baby's brain and spinal cord begin to form. The heart also begins to form. Your baby is now an embryo and is about the size of a sesame seed. At 7 weeks, your baby's brain and face are developing. By the end of this week, your baby is about the size of a blueberry. The organs have started developing by 8 weeks, and the heart beats regularly. Fingers and toes appear, as well as the sex organs. After 8 weeks, the baby is called a fetus. By the end of the first trimester, the baby is almost 3 inches in length. First trimester. Your body. During the first trimester of pregnancy, your body begins producing more hormones than usual. Estrogen and progesterone are 2 hormones that play an important role during the first trimester. Estrogen is produced by the ovaries. During the first trimester, estrogen promotes uterine growth, promotes breast growth and milk production, maintains the uterine lining, increases blood circulation, triggers the development of organs and bones in your baby. Progesterone is also made by ovaries. During the first trimester, progesterone keeps the placenta healthy, thickens the uterine lining, promotes breast growth. The increase in hormones affects almost every organ system in your body. Hormonal changes can trigger symptoms in the very first weeks of pregnancy. The most common first symptom of pregnancy is a missed period. Other common symptoms of pregnancy in the first trimester include nausea or vomiting, also known as morning sickness, tender, swollen breasts, increased urination, fatigue or extreme tiredness, food aversions or cravings, dizziness, heartburn and constipation, slight bleeding or cramping, mood swings. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. First trimester, your emotions. Pregnancy may cause mixed emotions. Even if you've been trying to have a baby and are excited about your pregnancy, Knowing that you're about to become a mother can add stress to your life. Common concerns for expectant mothers include health of the baby, adjustment to motherhood, cost of raising a child, the effect on romantic relationships, the effect on your activities or career. It is normal to have doubts about your pregnancy. You may find that you cry more easily or that you have mood swings. Take some time to recognize that what you are feeling is normal. Find ways to relax. Take baths, read a book, exercise, meditate, or practice yoga. To help ease stress brought on by your emotions, surround yourself with supportive people. Talk to your healthcare provider for additional support. Take time to discuss your excitement and joy as well as your doubts and worries with a partner or support system. Some women have an increased sex drive while they are pregnant. You may feel extra desirable, feminine, and beautiful. Other women may feel insecure about the weight gain and body changes caused by pregnancy. If you feel self-conscious about your changing body, remind yourself that your body is changing to keep you and your baby healthy throughout your pregnancy. Visits to your healthcare provider. Getting early and regular prenatal care is important for your health and the health of your developing baby. Your healthcare provider will give you a schedule of all the prenatal visits you should have while pregnant. You may be seen more often if you are older than 35 or if your pregnancy is high risk. During the first prenatal visit, you can expect your healthcare provider to ask about your health history, including diseases, operations, or past pregnancies. Ask about your family's health history. Do a complete physical exam, including a pelvic exam. Your healthcare provider will also do the following during your first prenatal visit. Take blood and urine for lab work. Check your blood pressure, height, and weight. Calculate your due date. Answer your questions. At your first prenatal visit, you should ask questions and discuss any issues related to your pregnancy. Find out all you can about how to stay healthy. Later prenatal visits are usually shorter than the first. During these visits, your healthcare provider will check on your health and make sure the baby is growing normally. Living healthy. Being pregnant may also require some lifestyle changes. The following includes some tips on what to do and what not to do while pregnant. Important tips for a healthy lifestyle while pregnant include: don't smoke, drink alcohol, or use illicit drugs. Avoid secondhand smoke, which can be harmful to you and your baby. Don't take hot baths or use hot tubs or saunas. Get plenty of sleep. Find ways to control stress. Women should gain a healthy amount of weight while pregnant. Talk to your healthcare provider to learn what a healthy amount is for you. You can nourish yourself and your baby by eating healthy. Smart choices about pregnancy nutrition can help you promote your baby's growth and development. Eat a diet that includes grains, fruits, vegetables, protein, dairy, and water. Even if you eat healthy, you may not get all the nutrients you need from your diet. Many doctors recommend starting to take a prenatal vitamin at least 3 months before becoming pregnant. You may need special supplements if you have dietary restrictions or certain health problems. Tell your healthcare provider before you take any new supplements or medications during pregnancy. Unless your healthcare provider tells you not to, try to get at least 2 hours and 30 minutes of aerobic activity each week. Aim for a moderate level of intensity. Try to spread your workouts throughout the week. It is important to get informed during your pregnancy. Read books, watch videos, and talk with moms you know. You can also ask your healthcare provider about childbirth education classes. These can help prepare you for the birth of your baby. While pregnant, you should stay away from chemicals. These include insecticides, solvents like some cleaners or paint thinners, lead, mercury, paint including paint fumes, Not all products have pregnancy warnings. If you're unsure about the safety of a product, ask your healthcare provider before using it. Toxoplasmosis is an infection caused by a parasite sometimes found in cat feces. If not treated, toxoplasmosis can cause birth defects. You can lower your risk by avoiding cat litter and wearing gloves while gardening. You should also avoid contact with rodents while pregnant. This includes pet rodents and their urine, droppings, or nesting material. Rodents can carry a virus that can be harmful or even deadly to your baby. Take steps to avoid illness while you are pregnant. One way to do this is by washing your hands frequently. When to call a healthcare provider. You should contact your healthcare provider at any point during your pregnancy if you are concerned about your health or the health of your baby. Although your body will go through a lot of changes, many of them are normal. But some changes should be reported to your healthcare provider. They may be signs of a problem. Call your healthcare provider if any of the following problems happen: vaginal bleeding, excessive nausea and vomiting, high fever, vaginal discharge and itching, pain or burning during urination, leg or calf pain, swelling on one side of the leg or calf. You experience symptoms of pre-existing chronic diseases like asthma. Remember, you can call your healthcare provider at any time to discuss concerns about your pregnancy. Getting answers to your questions can reduce stress, which is better for you and your baby.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. During pregnancy, hormonal changes can trigger symptoms as early as the very first week. The most common first symptom of pregnancy is missed period. Other common symptoms of pregnancy in the first trimester include morning sickness and tender, swollen breasts. Pregnancy may cause mixed emotions. Knowing that you're about to become a mother can add stress to your life. Some common concerns for expectant mothers include the health of the baby and the adjustment to motherhood. Being pregnant may require lifestyle changes. Do not smoke, drink alcohol, or use illicit drugs during pregnancy. Doing so can cause major health problems for you and your baby. Early and regular prenatal care is important for your health and your baby's health. You will be given a schedule of all the prenatal visits you should have while pregnant. Contact your healthcare provider at any point during your pregnancy if you are concerned about your health or the health of your baby. Thank you for using Explain.